Hello, my name is Sarah Huss. I am the Marketing and Communication Director here at Haxtun Health, and we are just now launching our first YouTube series called Health on the High Plains. And in this series, we are going to be talking with our healthcare providers and other healthcare professionals here at Haxtun Health, addressing questions that the public have for us and what it is that we do here at Haxtun Health and how it benefits our patients. So today we are going to be talking about direct access testing, and you're going to hear from Thea Bayer and Judd Dawson, and they're going to be asking and answering questions about the direct access testing that we offer here at Haxtun Health.
What is patient-directed testing?
Thank you for asking. So patient-directed testing is when a patient can order tests without a provider's prescription or orders. It's a way for a patient to be able to obtain some of the tests they feel like they need whenever they desire. The downside is they have to pay for that out of pocket. The upside is you don't have to see a provider to get the test done or to get the results.
Hey doctor, when I'm looking at my testing, what is the normal values and how are they determined?
So normal values are really complicated actually. They're based on a segment of the population that are deemed not to have any of the diseases we're looking for. They're tested and a statistical analysis is performed on the results. So we take everybody's results, however many we have. If it's 100 people, we take all 100 people, and we take the 95% of those values. So from the middle, 45.25 down, 45.25 up, and that is our normal range for every single test. The upside is that gives us a really good representation of what's normal in that community. The downside is 2.5% of people are still normal that are higher than that, and 2.5% of people are still normal that's lower than that. The other confusing part is there can be people with the disease who can show up within the normal range because the normal range is just a statistical analysis. And that's what makes interpreting test results a little more nuanced than maybe people realize.
So now how do those providers use those results to determine if there's something present?
As a provider, using tests to determine if somebody has or does not have a disease is a very nuanced process. We use a couple terms. One is sensitivity, and that's the ability of a test to tell you have the disease, to detect that you have it when you indeed have it. So if you had 100 people with the disease process and you tested them and 97% of the people came up positive, that's a 97% sensitive. It caught 97% of those people. The other term we use is specificity, and that's saying that, if we have 100 people with the disease process and another 100 normal people, that none of the normal people are said to have the disease. So let's say you have a test that's 98% specific. That means that only 2% of the people it says are positive may not actually have that disease process. And that is why when we look at lab results, oftentimes we say it looks like you may have, and it's hard to be definitive when we're talking to you.
What are the reasons that providers will use these testings through Haxtun Health?
So at Haxtun Health, we have the ability, or you have the ability as a patient to order quite a few different tests. One of them is hemoglobin A1C, and that is a great test to look and see if you have trouble with your blood sugar, maybe even diabetes or pre-diabetes. Another one is thyroid testing, including a free T4, which is one of the hormones made by your thyroid gland, along with TSH, which is the hormone that comes from your pituitary gland in your brain down to your thyroid to tell it how hard to work. Another test is a complete metabolic panel. That includes your liver function and kidney function, your electrolytes, and your sugar. Another test is a complete blood cell count, and it's looking at your cells, if you're anemic, if you have an infection or inflammation going on. You can order your analysis, along with a lipid panel, which is checking your cholesterol, vitamin D to look and see if you have enough of that to help control your calcium and bone health and immune health, along with a rapid strep test to look to see if you have strep throat. And as a side note, strep throat is very important because it is the cause of rheumatic heart disease, which can damage your heart valves, along with it can cause damage to your kidneys if those infections are left unchecked.
Thank you for watching. Now, if you made your way through that video and you still have questions about direct access testing, I encourage you to leave a comment in the comment section below. I will also leave a link to our website where you can learn more about direct access testing, and you can find that in the description box below. Thank you for watching, and stay tuned for other installments in our series.